Imagine this. According to the National Institute of Health, 2 in 3 Americans are overweight or have obesity. Well, weight isn't an automatic indicator of health. It's a conversation that affects millions of people, particularly women who face unique challenges in their health journeys. From the anxiety of being weighed at doctor's appointments to navigating menopause without proper support to understanding the complex relationship between muscle mass and metabolism, women's healthcare needs often go unaddressed or misunderstood. Today, we're diving deep into women's health with a focus on breaking down barriers, understanding our bodies, and advocating for the care we deserve. We'll explore everything from the limitations of BMI to the latest innovations in personalized medicine, including how prescription medications are changing the landscape of weight care. And we have the perfect guest to help us unpack this, Dr. Rekha Kumar. Dr. Kumar is an internationally recognized leader in obesity medicine and the chief medical officer at Found, where she's revolutionizing weight care through personalized medicine. She practices endocrinology at New York Presbyterian and has dedicated her career to making high quality healthcare more accessible to women. As both a physician and a leader in digital health, she brings a unique perspective on how women can navigate both traditional and innovative healthcare options to find what works best for them. Dr. Kumar, welcome to the show.
Thanks so much for having me on the show.
We are excited to have you and share all your wisdom and get to know you and why you do what you do. So, first, let's start with some quick yes or no or short answer rapid fire questions just for fun. Are you game?
I'm game.
Okay, let's do it. Lab coat or scrubs? Which do you prefer?
Scrubs.
I'm with you on that. I'm in my scrubs right now because after this, I'm going to go see patients.
Yeah, I like the cute scrubs, like,
Yes, they have to be
figs or
fitted.
something fitted.
It's very important. I love Janu and I love the colors. It's all about that color and the fit. Okay, second, what's your go-to healthy snack during busy days?
I would say a string cheese.
All right. Favorite way to get your heart rate up?
Walking around New York City.
And then you get to also see some amazing things, sometimes like some interesting things as well.
Yes.
All right, next. Did you ever consider a different specialty before falling in love with endocrinology?
Actually, no, I went to medical school knowing I would be an endocrinologist.
When you go to a coffee shop, what do you order?
I order a latte or a cappuccino with regular whole milk.
I love just black coffee, and I only drink a little bit of it, but it's just black coffee for me. Have you ever felt dismissed by a healthcare provider yourself?
Yes, I'm sure that I have. Thankfully, I haven't required up until this point a lot of healthcare, but yes.
Well, thank you for playing along. And now we'll get into the real conversation. What I'd like to start with is when we talk about women's health and the conversation, you are regularly having these types of conversations with women in your clinic. When I think of the field of endocrinology, which is all encompassing, I like to say from your head to your toes. And I wish more people highlighted that. What is something that you wish more women knew when it comes to overall health and endocrinology?
So many people that come see me don't often understand what an endocrinologist does or what the endocrine system does. And because you said it involves so many parts of the body, it's probably harder for someone to grasp versus when someone says cardiology studies the heart. When someone says, what does endocrinology study? And you say, oh, all of the glands that make hormones and then go do their job somewhere else, that's very confusing for people that aren't in science or medicine. What I wish people knew about the field of endocrinology, particularly women, is that it's a dynamic system in our body. It's always changing, not only day to day, but during the hours of the day and over our lifetime. The endocrine system is constantly either in transition or in some type of rhythm that varies throughout the day, throughout the night, and interacts with our environment as well.
That's why I was so excited to have this conversation with you because I honor the work that endocrinologists do. You are a powerhouse in many ways. That's why I think just being able to have people hear all of the things that you look at that you are navigating to help your patient, it's something that needs to be talked about. When we talk about women's health and our bodies and all the things that are a part of it, we can't forget that even when you are going to the doctor, you can feel this level of dismissal even before you get there. What have you done to really help your patients feel more welcomed, to feel honored when they come and see you? Because they might have a mixed bag of emotions from the beginning, and it can be hard.
So by the time people come to me, I would say that they're usually quite frustrated. I'm rarely the first stop. And although you acknowledge that endocrinology is a powerhouse, I would say that in medicine, some people use it as a dumping ground for places that they feel like they send patients that they can't figure anything else out. And so people often, when they land in my office, they've already been made to feel as if they've been complainers elsewhere in other doctors' offices. Often the first half of our visit sometimes is going through their prior experiences and what led them to me. And by telling that story and me acknowledging that they likely experienced that because of the complexity of the endocrine system and the time it takes to understand, assess, and diagnose an endocrine disorder, it's not in the wheelhouse of many physicians. And because of the time it takes, people tend to feel dismissed.
Like you mentioned, it's really complex, and being able to find out what caused this, how did this evolve, really taking in that patient's history even before they came to you, and then putting it forward really takes time. And when you've experienced this level of dismissal, you are worried. I mean, from a patient standpoint, when I see this doctor, what's going to happen to me? Am I really going to be acknowledged based on what's happened? When we talk about dismissal and symptoms and things that take a while sometimes to get diagnosed, of course, what we talk about is menopause, perimenopause, all different types of things that women often face. What has been your approach? I mean, yes, menopause is out there in the forefront, but I'd love to hear your unique approach to menopause.
My approach to menopause, perimenopause, or any possible symptom associated with hormonal change, my first step is to acknowledge that hormones could be responsible because that is not the experience of patients by the time they've come to me, where they've often been told, this is normal, your body changes, there's nothing we can do, eat less, exercise more, all of those things. And those things can be helpful, but I think acknowledging that there is some biology that's happening that is leading you to feel the way you feel would be my first step with these women experiencing perimenopause, menopause, or any other hormone transition, whether it's postpartum or anything like that.
You and I have heard and we learned that it's a natural form of transition. And I think you have that word, it really dilutes the thought that no, you shouldn't have to experience this. The whole combination of natural and that this should just happen makes people feel like, oh, I just have to deal with this. I have to feel these symptoms. I love to hear that you support your patients when they come in and think about what things can we do to get you back to who you are. And that leads me to my next question. We hear a lot about cardio, exercise, all the things important to us. And I know that you really have a unique approach when we talk about all of those pieces. Can you highlight some of those things?
With all of these things that are, in quotes, natural transitions, that doesn't mean that we shouldn't optimize during these stages. For example, it is natural for our bone mineral density to significantly decline as we get older. But that leads to fragility and fractures. We don't want to let natural things happen all the time to a degree that it causes disease. And I would say the same for menopause, perimenopause, and how that affects cardiac health. We do know that a postmenopausal woman's risk of having a heart attack is the same as that of a man. And as estrogen declines, we're at risk of heart disease. I do encourage women to do cardiovascular exercise. It's good for their heart, it's good for their brain. But the true organ of longevity, I would say, is muscle. And that's not something that people often talk about with women because there's this emphasis on thinness and leanness. But I would say from our mid to late 30s and beyond, if we can build our lean muscle mass that we will be less likely to be frail, less likely to have a fracture, less likely to get diabetes. Although cardiovascular exercise is important, I really emphasize strength training, balance, flexibility, and things that prevent us from getting hurt as we get older.
Protein and muscle mass and weight training isn't normally what we think about because there's this thought, oh, I need to do more cardio to lose weight versus what can I do to really strengthen my overall muscle mass and be able to function at the top. And in order to do that, it doesn't just fall to cardio, as you mentioned. Here's a reality check. While we're making progress in how openly we discuss weight and health, there's still a striking disconnect in getting support. According to a recent NIH study, 41% of people don't discuss their weight loss journey with family and friends because they fear judgment about their methods, even though most Americans have taken medication for other health conditions. When we talk about those factors such as cardio, muscle mass, protein, I can't help but not talk about BMI because that has been kind of our North Star, even though it shouldn't have been, as far as what we're supposed to obtain. What are your thoughts on the BMI? What do you think needs to happen?
We're really trying to move away from BMI or body mass index, and it really doesn't tell us anything about someone's health. It tells us generally how big or small somebody is. I always give the example that Arnold Schwarzenegger at his peak bodybuilding health fell into class 1 obesity with 8% body fat. You could have a lot of muscle mass and have a high BMI, and you could have really low muscle mass and have a low BMI and be quite unhealthy. We're moving to using other metrics such as waist circumference, waist to hip ratio. There's a new indicator called body roundness index that gives a better assessment of health based on body composition. BMI is a crude tool. I would say BMI values greater than 35 probably accurately reflects health risk. But for much of the BMI categories, normal, overweight, class 1 obesity, people can be fit and healthy in those ranges. And for low BMI and normal BMI, people can be unhealthy and be prone to disease. We're really trying to move away from body mass index and focus more on body composition.
BMI, the tool was built based on men. It did not have women a part of it. When I think about how it has shaped our relationship with our body and this feeling that we need to obtain something that is not based on any true science, it really has complicated not only our mental and our physical health. And it pours over into, getting weighed when you go to the doctor's office or being fixated on how much do I weigh versus how much muscle mass do I have, protein, all of those things. What can I do to invest in myself to build that? With my patients, I share, you do not have to get weighed when you come in and see me. That is not an indicator of your health. And to your point, it's all of those factors. My next question, I want to shift the focus when we talk about BMI, women's health, all of those factors. The one thing that I really love that you have done with your organization Found is revolutionize and take care from a new spin, a new perspective. Can you share with us a little bit more about that?
Our emphasis at Found is really on full body wellness. We want somebody to feel good in their body. We want to lower their risk of disease via treating excess body fat. We acknowledge that there's an amount of fat that can be unhealthy for people, and we combine behavior change with medical management of overweight and obesity when appropriate. Take that combined approach and deliver care through technology so more people have access to care of their metabolic health and their excess weight if that's bothering them. We do that through several clinicians, health coaches, people that use Found have access to a very active community that supports each other. We also use artificial intelligence to help us with coaching, food planning, exercise routines. It's a sophisticated way to address metabolic disease at scale.
The fact that you're putting technology into Found so you can reach as many people as possible, and I even think of really provide an individual form of care, which is needed because we are not all one size fits all, and that's what you're doing through Found. That leads me to a lot is out there about GLP-1 medications. You hear it everywhere like, "Oh, this one is the best medication to use. This one may have more side effects." I would love for you to share more about what your thoughts are about GLP-1 medications, the ones that you feel are or not the best for women, and how do you see it playing a role in the future?
I think GLP-1s have been fascinating to watch in terms of their evolution in today's society. They started out as great medicines 20 years ago for type 2 diabetes. I think they were a little stigmatized initially because they are injections. And so when we recommended this class of meds 20 years ago, patients were worried that we were putting them on insulin or something that felt closer to insulin because it came in an injection. But actually, going on GLP-1s can prevent somebody's likelihood of going on insulin because it protects the pancreas. I would say that these meds have evolved from diabetes medicines that carried a little bit of a stigma because they were an injection to then becoming a weight loss medicine that still carried a stigma 10 years ago where people that were on it didn't talk about it. And then as the years went by and the weekly injections like Zepbound and Wegovy became approved, and started to reach mainstream conversation, pop culture, celebrities, I think the conversation came more to the surface. But from a medical perspective, it was really the outcomes and the health outcomes data that made them game changers in the field of medicine, meaning a reduction in heart disease, reduction in fatty liver, sleep apnea, a reduction in risk of 10 different cancers in patients that take Wegovy. Yes, these medicines are becoming popular for many reasons. There's a lot of people using them to become thinner. That's not why they're exciting to us in medicine. They're exciting to us in medicine because they can improve cardiovascular health and reduce what is the biggest burden on our society, which is heart disease, stroke, and diabetes and cancer.
From a medical standpoint, highlighting that's the piece that we are excited about because for us, our goal is to help reduce your risks, really provide preventative care. And that part of the conversation or the narrative when we talk about GLP-1s aren't at the forefront. Yes, these medications are great, and we've highlighted how they can be transformational when it comes to longevity because if you can control heart disease, you can have your blood sugars controlled. What do you say to the women who can't afford this medication or who are unsure if they should even move forward? It's a difficult conversation, but it's a common conversation I'm sure you have daily.
It's a conversation that we have very frequently these days because so many people have heard of these medicines. And it may be the first time people are hearing of the use of medicine to help control their body fat and prevent disease, which then brings us to the conversation of this field of medicine, of obesity medicine, existed for decades prior to GLP 1s. If cost and accessibility are the biggest impediment to being on a GLP-1. There are older generation non GLP-1 medicines that we still prescribe as experts in the field of obesity medicine. All of these medicines are prescribed at Found and in academic obesity medicine centers. GLP-1s, although they are the new shiny fancy drug, they are not the only option.
I think that's an important message for everyone to hear because you get sucked into what you see on television, what you hear in the radio, and you feel like there's only a limited amount of options that you have. For any woman that's listening right now that might be feeling overwhelmed about where to start her health journey, what are your top three small wins that can create meaningful change?
My top three pieces of advice that could create meaningful change would include really prioritizing quality sleep and sleep hygiene. And again, easier said than done, especially for middle aged women, which I fall into that category with young kids, a career, and older parents, the whole thing. But I do think that focusing on sleep, sleep hygiene as best as we can will help us in the long run. I think reducing alcohol is a really big one. And even if women say to me, but I've always had a drink a day. It's how I relax. I remind people that their bodies change over time and how they handle alcohol is different than they did in their 20s, 30s, maybe even early 40s. People will complain. They'll say they notice they're more anxious, they can't sleep, their heart is racing, yet they continue this habit because it became their crutch to relax. Improving sleep, reducing alcohol, and strength training are probably my three biggest tips.
That reminder that you do change over time. Sometimes we forget we're just going through the motions. And those of us, I fall in that age category too, middle age, and we are taking care of so many different things in our lives. Think about something that just happened this morning. I'm looking at my kiddos and I'm like, oh my gosh, you're growing up so quickly. But then I forget I'm growing up too.
Me too.
If we can just remind ourselves we're growing up just like the people around us, it's a good lesson to keep at within ourselves.
I think I'm at like the first age where I think physically my kids can do more than me. We just took them on a ski vacation and I'm used to them being little and I'm the adult and they should follow what I do. But this is the first age, they're 13 and 11. I shouldn't keep up with them. That's not safe for me.
Yeah. It's interesting, like, what just happened? So my girls are 8 and 10, especially my 10-year-old. She'll say things to me and she is like, "I've got this." And I'm like, oh, you're right. You do. You're a real person." And we are hoping that they become real people. We want them to be kind to themselves, I always say, and then kind to others. But all of a sudden you feel a flash of, wow, you're doing your thing. And it goes by quickly. A nice circle back to ourselves and be like, okay, you're doing your thing. And what have you done for yourself? I
Yeah,
think that's
my
going to
thing on the
be.
ski slope was just trying not to fall.
I did a dance class with, they said, invite your parent to a dance class. And so I grew up dancing my whole life. I haven't taken a dance class in a long time. And I did it and I could not walk the next day. I had a fantastic time, but it was a lovely reminder that, like you mentioned, I should not keep up and I should not try to do what we call a bat ma because that kick is going to hurt my hip later on. As we wrap up, what message would you like to share with women who are struggling to be heard in their healthcare journey?
I think if a woman is struggling in her healthcare journey and doesn't feel like she has been listened to, or if she feels that she has been dismissed or told that what she's experiencing is just natural and she has to tolerate it, I do think that medicine is evolving and that there are doctors like ourselves that want to take care of these women. There are now so many telehealth platforms like Found and others that really want to focus on women's health and what affects women. There are more opportunities today than there have been before to find a caring clinician that wants to take care of you. If you don't have the right person, I would consider switching.
It's interesting because we think of these silos that are out there, and you tend to think that there aren't any other opportunities to get help or get information. And what we are sharing today is going to be really vital for people to know that there are other ways that you can help your health. And then the fact that you bring technology, all those factors, it's just wonderful. As we end, I just want to say, Dr. Kumar, you've given us so much valuable insight today. Thank you for helping us demystify these important aspects of women's health and empowering our listeners with practical advocacy tools. Did something in this episode click for you? Share it with someone who might need these insights too. Because here's the thing, real healthcare advocacy happens beyond clinical walls. It's about understanding our bodies, knowing our resources, and helping each other navigate the healthcare system. You've got this.